This is the skills validation for sterile technique. The first thing I'm going to do is the first 5. So I would wash my hands. I'm going to go into the room and introduce myself as well as identify the patient. Hi, my name is Samantha. I'm a student nurse at HAC and I'm going to be helping you today. Can you please tell me your name and date of birth? Okay, do you have any allergies? Great, and you just want to confirm on the wristband. So your doctor ordered for you to have a dressing change today, and that's what we're going to do now. I'm going to pull the curtain for privacy, and I am noting that this is an abdominal wound, so I would have a drape over their lap as well for additional privacy, and I want to maintain patient safety throughout. Before we begin, are you having any pain today? Okay, great. We can move forward with the dressing change then. So first we're going to begin by taking off the old dressing. When we're doing this, we want to just be mindful that the patient probably does not want to see what drainage may be on the bandage. So we're going to be careful and try to keep that out of view from them and pull it off away from them. Okay, and we're going to assess that drainage. So we're looking at the color of it. It does look like we have some purulent, a moderate amount of purulent drainage. There is a slight odor to it and it is pretty thick. So we can dispose of that in our trash bag. And then we're going to assess the incision in the surrounding area. So I'm noting that we do have a midline abdominal incision. We're going to assess for any redness on the incision, any swelling or edema, and any ecchymosis or bruising. So it looks pretty good, and we'll assess for the same things on the surrounding area. We're also noting that there are 6 staples intact, and the edges of the incision are well approximated and look like they're healing really nicely, so that's great. Right, so we're going to prepare for the sterile technique next and getting a new dressing on this incision. So we can remove our old gloves and dispose of those. We're going to wash our hands with hand sanitizer. And to prepare for the new dressing, we can get ourselves set up and tear the tape ahead of time. So since the tape is not sterile, we can hang that on the edge of the table so that it's there when we need it. We do want to have a pen handy. I'll initial and put the date and time on one of the pieces of tape so that we know that I changed the dressing on what day and at what time. Okay, so we're going to begin with opening our sterile supplies. So just make sure my hands are clean. We'll start with the 4x4. We want to make sure that that stays within the package and does not come outside of the sterile field. And we'll open the ABD pad next. Same thing, making sure that it's staying inside of the package and not coming out onto the table because that would contaminate it. We also want to be really mindful that we're not reaching over anything that has already been opened because that could potentially contaminate it as well. Okay, and next we can get our surgical gloves opened. Okay, so take that outside package off, and before we begin to don those, we'll make sure that our alcohol swabs are all set up and ready to go so that we can use them to clean the incision. So we have our alcohol swabs, and we want to make sure that we are not touching any part of them when we do open them. So we're tearing that off, and we can use a piece of tape to secure them to the table, just making sure that we're not touching those sticks. All right, so now we will put on our surgical gloves. Being really careful that when we're opening these, we're just touching the flaps and we're not coming in contact with the gloves at all, as that would contaminate them. Okay, so we'll put the left one on first. We're gonna just grab that with our right hand at the very bottom. And we're going to take a step away from that, from the packaging, so that we don't accidentally bump into that when we're putting on the glove. So keeping it above waist level and away from everything, we're going to get our hand into that. And just using the outside or the inside portion of that, pulling that down. And then we can touch the other glove with our sterile hand, and we're going to hook our 4 fingers into that cuff, like so, making sure that our thumb is away so that that doesn't come in contact with our other hand when we're putting this on. And again, stepping away from the table so we don't accidentally bump into that. And pulling that down. Okay, so we're going to clean the incision. Really important as well with the sterile gloves, when you have these on, you don't want to have them below your waist level or out of sight. If it's helpful, you can keep them clasped in front of you, just making sure that they're not coming in contact with anything that's not sterile. So we will get one of our alcohol swabs, and we're going to go down the middle first, and we can dispose of that swab. We don't want to get too close to our trash container, so we'll drop that in. And we're going to grab another swab. We'll go down the side this time. And drop that in. And the last one will go down the other side. Okay, so we're going to apply the dressing now. So we'll do the 4x4 first. And next we can apply the ABD pad. And we're going to tape those. Here we have the one with my initials and the date and time on it. Okay, so we're done with that, and we can throw away all of our trash. We're going to take off our surgical gloves. And wash our hands, and we'll check with the patient. You doing okay? Okay, good. If you need anything at all, feel free to call me in.